Well, the globe marks World Prematurity Day tomorrow. It's a massive effort now to raise awareness of the deaths and disabilities due to prematurity and the simple, proven, cost-effective measures that could prevent them. The South African Civil Society for Women, Adolescent and Children's Health, together with government, commemorate the day under the theme World Prematurity Day highlights effective, low-cost care. Well, Sue Jones is the Health and Nutrition Lead at Save the Children South Africa, and she joins us now from our Pretoria studios. Good afternoon, Sue, and thank you for your time on the channel.
Good afternoon, and thanks very much for inviting Save the Children South Africa.
Preterm birth, Sue, is still the world's largest killer of babies, causing more than 1 million deaths a year. Those stats are staggering. Why is it so difficult to turn the tide on this one?
Yes, I mean, it's very staggering figures, and actually 75% of those lives could be saved. So I think there's various issues in respect to how we can save these babies' lives, and really it is down to, as you said, you know, very low cost effective care. And I think some of the issues for these babies still dying is really because this basic care is not available, or the quality of this care is not there.
So how can we reduce these numbers? In South Africa, if we bring it home, we understand 8 out of every 100 babies are born prematurely. Talk to us about some of these cost-effective measures that you've mentioned that could prevent such preterm birth.
So yes, so that's 8% of babies that are still born premature. And just one important fact before I tell you about the low-cost care is really that this is, so the deaths from prematurity actually, it gives the largest contribution to under 5 mortality, or under 5 deaths in South Africa. That's the age of the child under 5. And there's 3 basic, you know, there's a package of 3 kind of basic care that could be given, and that one of those is breastfeeding. I mean, very kind of what's considered to be a very simple initiative. Second is kangaroo mother care, and that's basically when the baby is strapped to the mother and you know, by a blanket, and the baby is kept warm, and that allows bonding with the mother. And then the third thing is actually providing infection control, so actually treating infections with antibiotics as soon as possible. So those 3 things combined can actually save the lives of, you know, 75% of those 1 million babies that actually die every year.
When it comes to breast milk, Sue, in particular, for the survival of these babies, can you tell us why it's so crucial? And then there are still challenges around breastfeeding of preterm babies, in that sometimes the baby's mom would have to return home, and perhaps she lives far away from the hospital. There's a lack of transportation, or maybe simply there just isn't enough donor milk. Yes,
so breast milk is essential for any baby. It's really a standard way, a normal way of feeding babies. And in South Africa, unfortunately, we still have very, very low rates of breastfeeding. So that equates to about 8% of babies are exclusively breastfed to 6 months. So breast milk is essential because it provides all the nutrients that the babies need. It provides all the it provides that first kind of injection of antibodies that the baby needs. And yes, I mean, premature babies require breast milk to survive. And if the mother, you know, the mother is encouraged to breastfeed the baby if they can, and if the mother is unable to breastfeed, then hospitals all over the country are setting up initiatives to have human breast milk banks. So it is difficult. Sorry?
Go ahead, Sue. Go ahead.
Yes, sorry. So just to answer your last question, you know, it has been challenging to actually get people to donate breast milk, and I think there's a lot of taboo around that. So I think really we need to increase the awareness in the community of why it's important, you know, for preterm children, preterm infants to have breast milk, and why it's important for people to actually, for mothers to be donating breast milk, because this saves lives. It's very, very simple. It actually saves the lives of the premature babies.
This can be also an extremely emotionally, psychologically taxing time for parents as well, especially the mother, because once the preterm baby is released at goal weight, how crucial is support in terms of health care, counselling, etc., because there's still gaps here, and we don't want the mother to begin to feel isolated and alone with a very tiny baby to care for.
Yeah, I mean, I think you've already answered the question. I think it's essential that the mothers and the babies get that care on discharge from hospital. We actually held World Prematurity Day with the Department of Health today at an excellent hospital called Callafong Hospital in Victoria West. And, you know, the counselling and support is very much available in that hospital. You know, we need to extend that support to the community. So we need to be setting up support groups, breastfeeding support groups for mothers with premature infants, so that, you know, they don't feel isolated, so that they do feel that they get all the care that they need. And that could potentially be done through you know, ward-based outreach teams and community healthcare workers with the appropriate training.
So very quickly, before I let you go, there is a perception out there that preterm babies all suffer from disabilities and handicaps, etc. But they are very successful individuals, as shown on a list of famous premature babies in the world. I've checked, that's a UK website. It includes Albert Einstein, Isaac Newton and Charles Darwin, all share premature births. How do we begin to change this kind of mindset?
And I think those are very good examples of, you know, babies survive. Premature babies survive if they get the right care. And that's the important message here, to make sure that these babies get the right care, the breastfeeding, the kangaroo mother care, and the treatment of infections. Now, if those systems are in place, then babies will survive, and, you know, it doesn't necessarily mean that a child who's been born prematurely will be disabled. And I think what we need to do is actually really increase the awareness of prematurity in the community, which is exactly what we were doing today with the Department of Health. It's really the first time we've done this on World Prematurity Day.
Thank you.
We need to increase that awareness of what prematurity is and how, you know, we can prevent disability, and we can prevent, you know, and allow these babies to lead normal lives.
Thank you, Sue. I'm afraid we'll have to leave it there. We are out of time. That was Sue Jones. She's the Health and Nutrition Lead at Save the Children South Africa.